A miscarriage, also known as a spontaneous abortion, refers to the unforeseen termination of a pregnancy within the first 20 weeks of gestation. The loss of a pregnancy after week 20 is called a stillbirth. Around 80% of pregnancy loss occurs during the first trimester or 14 weeks of pregnancy. Miscarriages are beyond your control. Miscarriages can be due to a range of factors, including hormonal imbalances, improper implantation of the fertilized egg in the uterine lining, maternal age, uterine abnormalities, incompetent cervix, infection, exposure to torch diseases, severe malnutrition, smoking, alcohol consumption, immune system disorders like lupus, severe kidney disease, congenital heart disease, uncontrolled diabetes, thyroid disease, radiation exposure, and certain medications such as isotretinoin, an acne drug. However, chromosomal abnormalities account for approximately 50% of miscarriages during the first trimester of pregnancy. If an egg or sperm possesses an abnormal number of chromosomes, the developing fetus will also have an irregular count, leading to miscarriage. The symptoms of miscarriage can vary from person to person. For some, it may involve painful cramping and bleeding, like a heavy menstrual period. Others might experience cramps resembling those during menstruation. Interestingly, some individuals may not be aware of a pregnancy loss until they undergo a prenatal ultrasound, as symptoms may not be externally apparent. Common signs and symptoms are as follows: vaginal spotting or bleeding, which can be painful in some individuals. Pelvic cramps or lower back pain. The degree of pain depends on the type of miscarriage. Passage of large blood clots or tissue through the vagina. You should retrieve the tissue in a clean container and bring it to your doctor for an examination. Though most instances of miscarriage are not preventable, you can focus on your health to enhance the health of your baby. Always consult your doctor for preconception care and attend your prenatal appointments. Avoid alcohol consumption, smoking, and substance use. Take vitamin supplements as prescribed by the doctor. Limit your caffeine consumption to 200 milligrams daily, a 12-ounce cup. Inform your doctor if you have a pre-existing health condition. If the miscarriage is complete and your uterus is empty, you probably won't need further treatment. Sometimes all the tissue doesn't come out. If that happens, your doctor might recommend waiting a week or two for it to pass naturally. Or they may do a dilation and curettage (D&C) procedure. They'll dilate your cervix and gently remove any remaining tissue. There are also medications you can take that cause any tissue left in your uterus to leave your body. If it's later in the pregnancy and the fetus has died in the uterus, the doctor will induce labor and delivery. If your blood type is Rh negative, the doctor may give you a blood product called Rh immune globulin, ROTGAM. This prevents you from developing antibodies that could harm your baby or any future pregnancies. You may get blood tests, genetic tests, or medication if you've had 2 or more miscarriages in a row, recurrent miscarriage. To diagnose this condition, your doctor might use tests such as pelvic ultrasound, hysterosalpingogram, an X-ray of the uterus and fallopian tubes, hysteroscopy. The doctor uses a thin, telescope-like device inserted through your vagina and cervix to look inside your uterus. Hormone therapy. About half of the time, doctors can't find a cause. Even if they don't find a cause, your chances of having a baby are still good. 2 out of 3 people who've had recurrent miscarriages go on to have a successful pregnancy the next time. Thanks for watching the video, and for more videos like this, hit the subscribe button.